Hello. I hope you can hear me. I'm at a laundromat. It's called Love's. If you live in Sacramento or whatever, it's super cool, and you can drive for free. I should totally work there. Long story short, I'm going to do a video on different forms of therapy that I've taken, and what they mean, and what they've meant for me. I'm going to start off with the easiest one, psychoanalytic therapy, which is it's an annoying way of saying talk therapy, obviously created by Freud, and it's literally probably the best form, honestly, of all of them. It's the best in the sense of it should be the first form of therapy that you go through first off, but it's just you talking. It's literally just you talking, and it's honestly my favorite. Obviously, you can tell because I love to talk. But my first therapist that I fell in love with, because I had a couple before her. Her name was Sarah Clymer, and she's awesome. This is back in Michigan. There were sessions where I would come in and I'd be so emotionally charged. I'd be full of so much that I would sit down in that chair. Well, it was actually a really nice little love seat or whatever. Her office was phenomenal. As much, I would sit down and I would literally talk pretty much the entire session. And my favorite part about that is that when I did that one time, I think she maybe even picked up on it before I did it one time. She would extend little did I know, she was extending my scheduled meetings with her by 10 or 15 minutes. Instead of ending them earlier like we used to do, so we would usually end it at 50-minute mark, but then she would realize that I needed those extra minutes, and she needed the extra minutes to kind of converse with that entire pool of time where I was just talking with no responses. She didn't have time for responses. I was just going and going and going and going. And yeah, there were the subtle hints of communication that weren't words, verbal, that I got from her. But in as much, the whole point of that is to just rapid fire and go, because there's so much merit in all the things you say. The more you think about what you're saying in therapy, the higher the chance that you're going to lie, that you're going to say something that's not really true, and that you're going to edit your feelings and your emotions. And so I know for a solid fact, as she told me later on in our sessions, the reason she started giving me extra time is because she doesn't often have patients who can express themselves the way that I do. And my deep sense of introspection and my high emotions, both of those things worked collaboratively so that I could communicate to her these deep feelings and put images to things that otherwise most patients can't paint a picture, or to take a picture and break that down into words. So it's that was such important information for her as a therapist to be able to better help her other patients. And so that form of therapy is phenomenal in every single sense. I mean, it is a basic level form of therapy, but if you use it correctly, it could literally be an advanced form of therapy. It's just all about how you use it. And I think it is disgusting. I'm just going to say this right now. It's fucking disgusting if you go to therapy and you lie about something. That's like going to the doctor and lying. You're a fucking idiot. And you don't deserve to go to the doctor. You're a fucking idiot. Don't lie to your physicians. Don't lie to your therapists. Don't lie to your psychiatrists. Don't lie to your nurses. And don't lie to your counselors. If you're in fucking high school, don't fucking lie to your counselors. That's why we go to them. We go to them for help. And if you're lying about something, they're not going to be able to help you. And if you don't get the help that you feel that you're getting there, you can probably trace it back to your little fucking lie. I'm going to go back to being nice now. The next form of therapy that I eased into was cognitive behavioral therapy, or CBT. That's just understanding, it's pretty basic, it's just understanding how your behaviors have come about, how those behaviors affect all the things around you as well as yourself. And for me, with my diagnosis specifically, it helped me connect the dots between why this behavior would lead to this action, how a simple, seemingly innocuous comment would lead me to punching a wall and threatening someone's life. You know what I mean? Because you would think people are how did that lead to that? All the criticism and judgment is super fucking bullshit, because it's if somebody actually wanted to know, if somebody actually cared, they would sit there with you and connect the dots. But that's not anyone's job other than your therapist. And your therapist's job is literally to not judge you in that situation. And those behaviors specifically you need to go into detail about them and like the feelings and the thoughts and all the things surrounding, because they have such a skill. Cognitive behavioral therapy, which most therapists who are trained in psychoanalytic therapy are also trained in cognitive behavioral therapy. So it's a combined two-in-one thing. Because if your therapist is like, it's I think it's actually, I don't know how it is here in California, but in Michigan, she was required to be expert, or to have her training done in cognitive and in psychoanalytic behavioral therapy. But then she went to the next level, which I'm over cognitive behavioral therapy. Dialectical behavioral therapy, DBT. Dialectical behavioral therapy, DBT. DB motherfucking TTT. DBT is what saved my life. That's why it had its own little thing. I just made that up right now, by the way. DBT is dialectical behavioral therapy, and dialectical, or dialectic is, so dialectic, if you break that down in terms, it's the ability to have two contrasting things or ideas or what have you within the same space. So what is a good way to explain that? So say I'm in love with someone, but they do something that I utterly hate and despise them for, so I idolize them, but I devalue that action. It gives me the ability to understand that I love you deeply, and I want to treat that love well, but I do not love this thing that has affected me and made me feel hate, or caused me to feel hate in some way, shape, or form. And understanding that, like, that love doesn't go away just because I'm feeling this strong emotion of hate, you know? They can coexist in the same space, and it's not the end of the world. But I guess I wanted to show this while I'm talking about DBT. This is the basic workbook. This is a basic DBT workbook. I love it. When I say basic, I mean you can find so many online right now, but this one, I honestly, and I'm going to be honest with you guys, look, the furthest I go, I did it this page in purple. The furthest I went in this workbook is right here. This was right here. This was my last page 47. But that's only because I was in DBT therapy, and I bought this when I wasn't in DBT therapy. I was in DBT therapy while in the middle of this, I got into DBT therapy, and so all of this shit in this workbook, it was invalid. I mean, it's not invalid, but I didn't need it at the time because I was in fucking DBT therapy. I was doing 3 fucking hours in such a fucking therapy and shit, like fucking group therapy and then fucking individual therapy. It's like a lot of therapy, and so I wasn't gonna come home and fucking open this shit. So like, I'm gonna throw that over there. But now I am not in therapy. I am not actively in therapy. And I'm still getting myself established. And so this book that I just threw is actually now my lifeline. This is going to instill whatever skills and things that I haven't already instilled in myself within the therapy that I was actually in, the actual physical therapy. Like, you know what I mean. All in all though, it's important to like have shit like this. I mean, I bought a lot of this shit at the beginning when I was trying to just learn about what's going on here, you know? But like in the end, I didn't realize that this collective of stuff was, because I've been looking at this book for years, just like wondering, why haven't I completed it? Like, am I bad at this? But no, I just had other sources of getting the information, and now this is what I need. And this is what I'm ready for. This is real. When I say this is my lifeline, I'm sitting here and I'm communicating with you guys effectively about like all the different things that I can do and that I'm capable of. But like, if I don't do this, that stuff can go away. Like, that's the scariest part about this whole thing is like everything we're doing, like you got to continue to work at it all the time, forever, until you're professional at it. And we don't get paid for it. But sometimes it doesn't get noticed. But it's worth it, honestly. Like, it's worth it's worth all the work because, like, in the end, like, what else are we gonna fucking do? You know, just like run around being all hectic and shit. So those are all the forms of therapy that I've taken, and that's what I said I was going to talk about. So I think something's going on in here, really. So I'm going to go. Thank you.